The Minister of Health, Dr. Joe Phahla, last week announced that the National Department of Health would be taking up a vaccination program that would incentivize people over the age of 60 years old who vaccinate for COVID-19 in the month of November. The program is set to give the said group with 100 Rand grocery vouchers that would be used at certain stores. The program, valued at 26 million Rand, will see 260,000 people receive the vouchers on a first-come, first-served basis. A similar strategy has been seen in other parts of the world, and better known as vaccine lotteries, with thousands of dollars, cars and gift vouchers were awarded to people to take the vaccine. Now, while the program encourages the uptake of vaccines, especially for people who are deemed as vulnerable groups at a greater risk of COVID-19 mortality, there has been much criticism about the 100 Rand grocery voucher, what it would buy when the basic household food basket costs more than 4,000 Rand, which further legitimizes calls for the basic income grant to be fast-tracked. For more on this, we speak to Director at Rural Health Advocacy Project, Resberg. Russell, good morning. Thank you for speaking to us. So that VUMA voucher worth 100 Rand, is it a good move or not, in your opinion?
I think we don't have to look at the voucher as alleviating hunger, and rather looking at it as an incentive to getting vulnerable groups to vaccinate. Personally, maybe I wouldn't have chosen a food voucher, but when we look at the general deprivation and potentially where many of the unvaccinated over 60s are, I think any kind of incentive to get people vaccinated or vaccines into their arms before the emergence of the fourth wave can really help us over the long run. But I think we have to sort of decouple the conversation around the value of the voucher with general food insecurity in the country.
So let's rewind a little bit and go back to, you rural health advocacy. So you would know to a very large extent why members of the rural communities are not getting vaccinated. Talk to us about that.
Look, I think at the moment there's no real clear evidence as to what is really stopping vaccinations. But I think from the beginning, when we were participating in various fora around how do we manage the vaccine implementation, I think as a system, we tended to focus much more on the supply side stuff. So setting up vaccine sites, making sure that staff are adequately trained, and so forth and etc. And it was a very medicalized, exceptionalized approach to it. And I think what we needed to do and what we are beginning to do now is focus a little bit more on demand side strategy, understanding why people are not coming to vaccinate. Is it a situation of the health facility being too far away from them? Is it the time that it takes? So even when we're vaccinating people in ground queues, it still takes about 3 or 4 hours out of their day in order to stand in the queue, to get vaccinated and so forth. So I think a lot of the perceptions around on ease of use may be what is stopping people from getting vaccinations. And I think our call right from the beginning has been, let's take the vaccines to the people instead of asking for the people to come for the vaccine. So I think at the moment we need much more stronger demand side strategies and make use of local assets like churches, sports groups, youth groups and so forth to get people to come and get the vaccination, rather than say build it and they will come kind of vibes that we've been doing for the most part of the rollout.
So let's go back to the incentive, because obviously it is about the general health of the population of South Africa. It is necessary for us to achieve herd immunity, and I think 60% of the 60 and older have been vaccinated, if I'm not mistaken. So the incentive, the voucher at 100 Rand, is it a fair incentive?
Look, it's difficult to judge whether it's a fair incentive or not, but I don't necessarily think that it will alleviate food insecurity, and I think we have different mechanisms and different debates around what is the best way to do that. But I think in the short term, any kind of incentive to get people or to encourage them and their family members to get to vaccination sites is useful. When we look at vaccine coverage at over 60s, it's currently only sitting at 55%. And it's difficult to sort of determine what is the level of herd immunity amongst that groups. But what we do know is that people that are over 60 are probably at increased risk of hospitalization and linked to that increased risk of death. So if we think about the fourth wave coming through, the priority must be on vaccinating that group. And if the incentives are part of a program to increase vaccine uptake to at least 80% or 90% of that population group, I think it's money well spent there. because I think the cost of hospitalization and the cost of death to the family and the void that it leaves to those family members is much higher than any cost that we would invest in the short term in getting more people vaccinated. But 55% is not enough coverage. And I think when we break that down even further to like districts and sub-districts, urban and rural, there could be a strong chance that, in the more deprived areas, vaccination rates amongst those older groups is much lower. So in that sense, the incentive is a good idea and hopefully will push us in the right direction.
So obviously, 100 Rand is not specifically for alleviating hunger to these marginalized communities or people over 60. It really is as an incentive to encourage them to go and get vaccinated and achieve the herd immunity numbers that we're speaking of. But obviously, it brings to the fore the issue of the basic grant. And what are your thoughts around that?
No, I think now is as good one thing that the pandemic has exposed brutally in this country is really just high levels of poverty and inequality, right? And its impact on things like access to healthcare services. We need to just look at the difference between official deaths and excess deaths to get a sense that maybe like even up to 70% of people who died from COVID may never have reached the health center. And a lot of that has to do with poverty and inequality. And then when we look at COVID-related lockdowns and impacts on employment and what kind of impact that had on rural communities, particularly those in the former homelands, who are heavily reliant on transfers from family members who come up to urban areas to work. And when that money dried up, we had a pandemic or an epidemic of hunger in our country. And I think there are many sources that suggest that. And I think as we move forward, and one of the things that the President spoke about as very early on in the pandemic is that we would emerge out of this a stronger, more caring nation. And I think the introduction of a basic income grant, at least at the upper bound poverty limit of 1,000 Rand per person, could significantly contribute to alleviating the impact of hunger and poverty and inequality on people's broader development in South Africa. And I think we need a long-term measure. What that measure is within our current fiscal context is going to be hard. It's not going to be an easy thing. Just because we ask it doesn't mean that they're going to give it. And I think we need to pay careful attention to that. If you add to that and you look at unemployment numbers and where unemployment is concentrated, in the rural areas, up to 90% of young people are unemployed and don't have access to work opportunities. So current measures like a child support grant or an old age grant or a disability grant only cover a fraction of the population. So I think now more than ever, I think we need to really get behind this idea of a basic income grant. And even if you can't give it to everybody, we need to make sure that at least the most vulnerable can access that grant or continue to access that grant over the next 12 months as we try and figure out in what direction our economy will go in a post-crisis environment. So it's not whether we should. I think we absolutely must invest and get behind the implementation of a long-term social security grant that extends beyond just the current social grants that are available. I would even go so far as to say that maybe let's just cut back on some of other expenditures, given the leakages that we have around corruption and the like, and invest more in direct transfers, which will probably have a much bigger impact on local economic development in rural areas than any grandiose plans that politicians may have in the short term.
Now, in a number of conversations that some of my colleagues have had on 405, the 350 Rand grant has been well received in urban areas. Now, talk to us about the impact that 350 Rand would make on a family or an individual in some of these rural communities that you're familiar with.
Look, I think in the first instance, like many of the people that received that 350 grant may have never had their own income before, so they were completely outside of the social security net. So I think in the short term, just, having the ability to decide your own fate, freedom sometimes is the ability to direct the course of your own life, right? And I think having access to your own money, which the 350 does, right, can give incredible amounts of dignity just to people to be able to make decisions that they previously couldn't make, where they're reliant on others to buy even the most basic essentials. So if you don't have any form of income, you're reliant on everybody else. So just getting, however small that amount is, having money that you have control over can do so much in improving your own sense of dignity in the first instance. I think it can contribute to local economies through increased consumption. And we haven't really seen the numbers around that, so we're waiting for the researchers to give us a better sense of what the impact of the 350 grant has been on those communities where there's very limited local economic activity. But I think the results will show that we've had an uptake in consumption. And an uptake in consumption over the longer run could also result in more jobs in those areas. On its own, it's not a solution. But I think it's a short-term stopgap. And then linked with other programs like maybe the youth job guarantees to repair our failing infrastructure could contribute significantly to achieving that better life for all that we aspire to in the preamble of our Constitution. But I think the important thing is that we need to not see it as some kind of leakage from government expenditure, and rather see it as an investment in unleashing the potential of all people over the next 10 to 25 years, something that we haven't done in the first 27 years of our democracy. So I think it's a fairly simple measure that we should find the money for, that can have impacts way beyond just having 350 in someone's pocket. It could lead to improved educational outcomes as household incomes rise. So if you say there's a family of around 7, right, which the Resberg Economic Justice Project uses when calculating the value of a food basket. If you just did simple maths and said, okay, fine, there was one old age person who received 1,900. Up until now, that 1,900, along with maybe 3 under 18 kids, who would each receive around 450 in a child support grant, the household income, in essence, would go to just over 2,500 rand. Right? So if we add another 900 rand, that takes us up to about 4,000 rand household income that can then be used towards advancing other outcomes. So I think in the short term, that 4,000 isn't even enough to cover the household food needs of that community, but it's a lot better than just having 2,000 or 3,000 rand available, forcing communities to make difficult decisions between energy use, which is electricity and the like, which they have to pay for, water, and other needs around their food needs. So we need to seriously address this. And I think the expansion of social assistance is an important component of that.
Russell, appreciate your time. Russell Resberg, Rural Health Advocacy Project Director, speaking to us this morning. You're watching